All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the discussion that we'll do today is a short discussion. Yesterday, we looked at the VAERS system and many cool beans responded back to me and said, we see that you used it, but we are still not very clear how to use it, number one. And number two, I myself made a mistake in there when I was looking at number of deaths and anaphylaxis. So I wanted to make sure that number one, I can present to you how to use it. And number two, I can probably look at one or two symptoms as well. So again, this is not going to be the whole discussion like yesterday, but just how to use this system. The benefit of doing that is that instead of listening to the rumors, you can actually go in and look at the VAERS system by yourself and see what kind of symptoms are there and form an opinion. And I think that is a very powerful thing for us at this time. So let's look at it. So here is the link, and I have the link in the description as well. Basically, it is wonder.cdc.gov/VAERS, vaccine, VAERS, adverse effect reporting system, vaccine adverse effects reporting system, VAERS.html. That is where you go. The first thing is, so some of the cool beans yesterday said, hey, we went to this and we could not work with the site at all. That is because you have to first agree on the disclaimer. That disclaimer is going to say, here it is, that, hey, we are not responsible for anything. So you have to first agree on that. If you don't agree on that disclaimer, you cannot really work with anything here. So first thing to do is to go down here on the page and then read the disclaimer and then say, I agree. If you agreed without reading it, then that is fine too. So once you have agreed, then these buttons on top or tabs on top will become active. Second thing now is go to the very first tab called request form, and you click on that. Now, please realize that this request form is for all kind of vaccines, not just the COVID. So you have to now filter the data from here for what you are interested in. You can actually download this data in a text form as well, or an Excel sheet as well, to do further reporting or calculations on it. I suspect that many of the news outlets use the data from here to then summarize it and then mention that in their articles. So let's look at it, how to work with it. Let's say I'm going to go with anaphylaxis once more. I did the wrong calculation yesterday. So I don't want to read about the anaphylaxis. I just want to see the number of anaphylaxis or allergic reactions in Moderna, Johnson & Johnson, and Pfizer. So the first thing here, which it says group results by. So I'm going to say by vaccine manufacturer. If I wanted to read every single complaint as well or report as well, then in the second one, I could have said VAERS ID and then click on adverse event description. If I do this, then for every manufacturer, there will be a list of the symptoms plus the description that was reported by the doctor or by the patient. So at this time, I don't want to do that. First of all, I just want to see the total, the counts. So vaccine manufacturer. Then we go down here and it says select symptoms. And this is where the weird things happen. But anyways, what you need to do is go to the search tab here and type, and look at this. This is how they just, I wish they used Ajax here. So you go in here and you can write multiple things over here that you're looking for: fever or rash or irritation. So I am just going to say anaphylaxis. And then you click search here. So you search here first. And what they would do is they will go over all the reported data and search for the word that you have chosen, and then come back with a list of all the cases which would have the anaphylaxis in it. So if you see here, here. Sorry, the page is just a mess. So see over here, it says now anaphylactic reaction. So I'm just going to click on this one. If there are multiple, for example, with the death yesterday, we saw accidental death or cardiac sudden death or brain death or other. So you can select the ones that are most relevant. So here there is just one option and I'm selecting it. I think you could keep all symptoms as well and it would just select that one. But I'm just going to select this one. So when you select something, it would appear on this right side here. So now we have selected for anaphylaxis. Then down here, which vaccine? Do you want to see anaphylaxis by all the vaccines? Then you just leave it as all vaccines. But we are interested today to see anaphylaxis with COVID-19 vaccines. So I'm going to click on that. With that, so if you see here on the right side, it has selected COVID-19. Then if I go down here, which manufacturers? So if I do not choose individual manufacturers, although I have said group by manufacturers, it would still somehow just give me one total. So I am going to choose, and this tells you that I myself am not that proficient with their system, but let's say Janssen, that is the Johnson & Johnson. Then we would have Moderna here. And so I am, on my Mac computer, I'm pressing Option button to select more than one. So if you see here, where was the Janssen, actually Command button, Moderna. So Command, I'm sure it is Control on Windows. So Janssen, Moderna, and then Pfizer here, Pfizer BioNTech. So I just want to make sure that all three are selected. Then if you are more interested in, for example, first dose or second dose, you could choose that here as well. Then if you're more interested in, the age group, or for example, so far, some Cool Bean pointed out yesterday, majority of the vaccines given so far are healthcare professionals or people who are 65 years of age and above, or people with the comorbidities. So you could further filter it down. I'm not going to do it, and I'm going to continue. Then here you can reduce the time frame for which you want to see the adverse effects. For example, you could say, I just want to see the adverse effect, whatever you're looking for, in last 1 month. So if that is the case, if you see here, this is the point number 8, select report received date. This is the received date. It does not mean it happened that day. So you could say, for example, something here. I want to see it from, let's say, January of last year, 2020. Of course, there were no vaccines at this time, but it puts the date enough early till now. Or you could say beginning of this year till now. So whatever is the date duration that you want. If you want it further, that when did the person get vaccinated, that you can do here as well. Then select adverse event onset date. You can do that here as well. Then select death date if death occurred. So I'm going to leave that all and just going to go here and click on the send. So I'm going to now make it small just to show you. This is the whole form we went over. And then here, when I say send, it would say processing, and here are the results. And of course, these results, remember yesterday I was seeing these results to be the total number of adverse reactions. So that was wrong of me. So 85 here and 170 here were the reactions. And I think I got the anaphylactic reactions correctly. It was the death number that was wrong. So these are the ones. Then between them, we have this as well, that 33% of these anaphylaxis occurred in Moderna and 66.9% occurred in Pfizer, which scares me or concerns me. The reason for that concern is I don't think that Pfizer is given in double the doses. So if it has double the number of reactions, then was it given in double the doses? I don't have that data. So I may not be correctly concerned, but if they are near each other, let's say one is 47 million and the other one is 60 million, they're kind of near, but over here, this is a double for each other. Now, there is nothing for Johnson & Johnson. So Johnson & Johnson, I think, is under 1 million so far, and they have no adverse reaction or anaphylaxis. And now you could actually go in and you can download this. So if you see here, there are options to dataset documentation, other data access. There is a save here. There is an export here. If you save it, this data will be saved on this page. And if you export it, they would give you a text file or CVS, and you can download that data as well. So this is, let's say, anaphylaxis, 85. I know that at least Moderna is 47 million doses given. And the Pfizer is more than that. So out of it, 47 million, 85 anaphylaxis, and out of 50 or more million, 170. Now, if you said, hey, I want to read what is going on in these reports, then you go back to the requested form. Now we want to read the description. If that is the case, then you go here, you leave the whole thing as it is, but just take one more field from here and say, I want to have VAERS ID. So now what will happen is that when it would generate the report, it would generate the report by each one complaint. And for that, you want to read the description as well. So you have to click this. So this VAERS ID and this adverse event description, they both have to be selected. Once that is done, you could select the other things if you wanted. But once that is done, and now if you go down here and say send, luckily the page keeps the rest of the data. And let me just quickly verify it. Most important thing for me to verify is COVID-19 and number 2, anaphylaxis here. Now if I do send, and you can see this is processing, now over here, there is individual descriptions. And these on top, the disclaimers that, hey, we receive this data every Friday, then we update it. The reason they have put that is that, let's say you or somebody you know has just submitted their report, and now you want to come in here and see if that shows up, or did they just hide it? That is when they're saying, hey, we do it till every Friday, and then it takes some time to process it. So don't worry if your own report is not showing up. We will show it. So that is this. And now you can once again see these. You wanted to save them, you could save them. You wanted to export them, you could export. For example, if I say export, then here, if you see, it is giving me a text file in which all of this data will be exported. And then I can do further analysis on top of that. So I hope that gives us some information for how to use this. This discussion that I wanted to do was not about a specific symptom, but to understand how to use this system. So Doug says people try to report J&J problems, but only find Janssen because the J&J's vaccine is under their subsidiary whose name is Janssen. So the J&J vaccine is nothing. It is Janssen's vaccine. So whenever you're going to look for Johnson & Johnson, look for Janssen. Awesome. So I'm going to hang up once more, and then I'm going to come back here and we'll do some chit chat as well. So please like, subscribe, and share. There are 3 links in the description. One is for the Patreon, another one is to buy me coffee, and the third one is to support this work. Thank you very much, and I would see you shortly.